Hi everyone, my name is Gray. I'm the dietitian and health coach with MLK Health Center and Pharmacy. November is National Diabetes Month, so this is a really good time to bring attention to the disease of diabetes and really help people understand what it is and how detrimental it can be for our health. Just a little over 10% of the US population has diabetes. So for those of you that just are completely unfamiliar, there are three types of diabetes. There's type 1, it used to be called juvenile diabetes. This usually comes on during childhood. It's an autoimmune disease. So basically your body attacks parts of your own pancreas and that messes with your hormones so you can't regulate your blood sugar. Type 2 diabetes used to be called adult onset. So this is typically brought on by a poor lifestyle or genetics or both. So this usually shows up later in life, but it's where your metabolism has just kind of gotten out of whack. And again, you can't regulate your blood sugar. And then that last type is gestational diabetes. And this is specific to pregnant women. So it's potentially a temporary diabetes where your blood sugar and metabolism are out of whack just during that pregnancy phase. But sometimes it persists even after somebody gives birth. So when I say blood sugar, I literally mean sugar in the blood. So when diabetics have out of control sugars, what's happening is that the food that we're eating, it's getting broken down into sugars that go into our bloodstream, but they're not being pulled out of the blood like they're supposed to. So we literally have more sugar in our blood than we should. So blood sugars can get to really dangerously high levels. And what happens is we just have a lot of stuff in our tubing, in our blood vessels, essentially. So when all of this sugar gets into these little tiny blood vessels, it causes damage. It's essentially the same thing as going from like a fire hose size down to something the size of this pen. We have a lot of stuff in that larger blood vessel. Basically, it's not going to do so much damage, but when we narrow down into something teeny tiny, that sugar is really going to tear up those little vessels. So that's what's happening with the blood vessels in our fingers, our toes, our eyes, our kidneys. All of these places have these little tiny blood vessels that get damaged by that sugar. So this can cause numbness and tingling. It could mean that wounds aren't healing because that blood supply is not able to get the oxygen and nutrients that those parts of the body need. It can cause vision problems, kidney issues, and even later in life, it can be a risk factor for Alzheimer's. So there are lots of things that can go wrong if we don't take the steps that we need to prevent diabetes. But then if we have it, we need to manage it, because if we don't, we have all these long-term consequences that could come from that. So if you're not sure if you have diabetes, there are a few things to consider, a few risk factors. So if you're overweight or obese, you're at a higher risk. If you're inactive, that's a risk factor as well. If you have a family history, so mom, dad, brother, sister, you're at a higher risk. If you're over 40, then your risk is higher as well. If you're a woman and had gestational diabetes. And then the last one is if you have elevated blood pressure. If you're looking at that list and you have 2 or more of those risk factors, I would absolutely encourage you to communicate with your doctor and make sure you're getting screened for diabetes regularly, because catching it in advance can really make a difference in how quickly you get it managed, either through lifestyle or medication. The final thing that I want to talk about is pre-diabetes and potentially doing things to prevent full-blown diabetes, especially type 2 diabetes, where there's more opportunity to prevent that. So with pre-diabetes, that's essentially sort of this in-between point between normal and full-blown diabetic. It's this opportunity where your body is kind of giving you some red flags like, hey, we're not full-blown diabetic, but we're moving in that direction. Our sugars are not quite as well controlled as they should be. It's estimated that 1 in 3 Americans, so a third of Americans, have prediabetes, and that 80% of them don't know it, which is really scary because that means there are a lot of people walking around with prediabetes. They have no idea, and they could be just a few weeks or months away from developing full-blown diabetes. So like I said, if you had 2 or more of those risk factors that I talked about previously, go to your doctor, ask for a screening. There's a fasting blood sugar, that's a finger stick, or something called a hemoglobin A1C, or just A1C, that they can check, and that's going to let you know if you're at a higher, or if you are pre-diabetic or diabetic. If you do find that you do have prediabetes and you want to do something to prevent full-blown type 2 diabetes, please reach out to us at MLK. We are actually starting a diabetes prevention program starting in January of 2021. So this is going to be a comprehensive program. We're going to talk about all kinds of things that you can do in a variety, just lifestyle things that you can do to improve your health and lower that risk of developing diabetes. There will be other people, so there's a chance to have that connection and that accountability, I guess, from other people. So reach out to us at the clinic. It's a great opportunity, but like I said, if you think you might be at a higher risk, it doesn't hurt to get checked, just so you can have that information and really stay ahead of it. As always, I hope this was helpful. If you have interest in other nutrition or wellness videos, please check out our YouTube channel. Thanks for watching.